was so touched when I read an article in the Newsday. That's why I was saying, who's Newsday? It's do it.
Rexon Pisa.
Rexon Pisa.
Yes.
Okay. I was very, very touched with the sentimentality. He really wanted me to be here last week. And he could not hold it to himself here to write it in the paper so that everybody knows that he wanted me here. This is very good. It shows that this is a very important subject. See, I read your article. Don't worry. You didn't have to send me a WhatsApp. I read it through your paper. So we communicated well. So, what I want to say, first of all, we have to fight rumors. To our media friends, we must fight rumors together and be able to publish the correct information. Otherwise, we'll end up in a situation where there is so much confusion when we could simply streamline and work in one direction. So, Honorable Minister, I'm really happy to be here. Yourself and myself have got a big task. Don't just say it's help. It's you as well, because you are the resident minister here. We depend on you to make sure that things happen. So last time I was in Plumtree, I know you were the vice president, but your fellow resident ministers from Mat South, from Mat North and Bulawayo, they were there, standing in for you. So I'm very happy that you are here today, and I'm also very happy, to have met the senior members of staff who are here, who are making sure that things go on well at this body. Very happy with the figures that you gave us, Chief Immigration Officer. That is the most important statistic, because we need to know who we are dealing with, who is the vulnerable candidate. I want to welcome all of you, who are here for your efforts. Thank you very much, the Provincial Medical Director and his team. I was equally very, very pleased to note that the schools, the education are here. Because we have to bring awareness to everyone. And one of the quickest way of bringing awareness is by dissipating the information through the schools. They'll go back home and start educating and teaching their parents. Whether they like it or not, they'll be told. And they will listen to that little boy or little girl. So this is very, very good approach. So thank you very much. What is it that we are gathering here for? Is the main issue. We are gathering here for a particular problem, a medical problem, where a disease has evolved. A disease has what? Evolved. This virus is normally found in animals. And therefore, the virus has managed to come from the animals to humans. So it's a zoonotic disease, zoonotic condition between animals and humans. Now that it's in humans, it's now spreading human to human, which has now become dangerous. And we noticed that initially it was referred to as the 2019 novel, meaning new, coronavirus. And then, which was referred to as 2019 nCoV. So as time went on, the World Health Organization has now decided to call it the COVID-19. Again, CO standing for corona, VI standing for virus, and D is now disease. And 19 relating to when it was picked up. So, this is what we are dealing with. And mostly it was in Hubei province, in a town called Wuhan in China. And then it spread in all of China, and then Asia, and then to other countries, like you indicated, several other countries. That's where this is. So we have to make sure that we are also careful and well protected. And how do we protect ourselves? A good thing is that there is no coronavirus or COVID-19 in Zimbabwe. And we want to keep it that way. And how do we keep it that way is the issue. That's why we all have to play a major part as a community. And here in Beitbridge, there's a whole community of Beitbridge, and specifically as the team that is working at this border. This border post, like you said, is a very critical border post, which sees large numbers of people coming through. So we must make sure that this border post will not leak, not even a single case of the coronavirus. Surely you don't want to be the first ones to be noted as the ones who brought in the virus, do you? So that's why I'm so happy that you all came to make sure that you are fully aware and working in line with everyone. It's now not an issue of port health only, please. It's not an issue of port health only. It's an issue of immigration, an issue of President, Department of Defense, whichever section, EMA, everyone, ZIMRA. We all have to be, the police, we all have to be vigilant, and making sure that things are being done properly. That's why me and Minister are here talking to you, to make sure that you become completely involved in this whole exercise. It's not an issue of just the Minister of Health and Port Health. You have to look and see, and if there is something that has to be corrected, if you pick it up, correct it. Correct it. You don't want your border to be the one which is going to be castigated by everyone as having allowed cases to go through. You see one of yours doing the wrong thing, caution them. That's not what we were taught. So we're here to further emphasize, bolster the already existing education that you might have acquired, and making sure that everybody knows what's happening in whose house. It's no longer just your house, it's everybody's house. And we are working as one. Zimbabwe does not have a single case of coronavirus as me and you speak here now. So I want to appeal to you, to yourselves. You're the ones who come to this very important meeting. I want you to say that you will not allow coronavirus to enter through Beitbridge border post. Don't leave it to him only, or to the health authorities. I want you to say, I will not allow coronavirus to enter Zimbabwe through Beitbridge border posts. We are going to ensure that we work as a team to screen and make sure that Zimbabwe remains coronavirus free. This is a commitment. And I want you to go and repeat it also at home and to the community. We must do that. That is the key issue that we have to achieve. I was also very happy to note that the numbers of people who are coming out of Asia are still limited to 100 a month. That's correct, isn't it? So that's a good starting point. You know, South Africa is not yet affected. There's no case. The rest of Africa is not yet affected. You know, so we don't want to be also the number one in Africa. We want to stay free of the problem. The issues of awareness we are being supported by UNICEF as well. Awareness is very critical, and that's one of the issues I want to really dwell on today. Making sure that the whole nation hears that we want everybody to be aware of the existence of this condition, the symptoms related to it, and what is available in terms of how it can be treated. We heard from Minister, rightfully said, there's no vaccine for COVID-19. That is very true. But in as far as treatment is concerned, through research, trial and error, in China, they managed to treat some patients who have recovered using ARVs, ordinary ARVs that we use, but the specific ones called Caletra, which was more effective. That's a good starting point. Yes, we would like to further research and make sure that things happen appropriately. I want to start with those issues which are remote from the border control and talk about the assistance that we've also gotten from the corporate world here in Zimbabwe. We are very grateful that, as a response mechanism, we've had companies like Mimosa giving us support by getting us thermal detectors, which we use for checking the temperature at the borders at all our ports. They bought us new equipment and it should be installed, like here, for instance, as soon as it arrives. We are also grateful to Zimplatz. I want to announce that Zimplatz have requested for our requirements list, and they're going to give us support. In actual fact, they're meeting today to finalize our requirements. So the corporate world, we continue seeking for assistance. When something of this nature occurs, the preparedness requires a lot of finance, to be put in place. Government has naturally, worked on the project, and government is in a position also to be able to give assistance, to identify, all our requirements, but we still require the assistance from the corporates in order to ease the burden, for government. We have quite a number of border posts, the air posts, and also the ground posts. Of the airports, Harare, Robert Gabriel Mugabe, we assessed it and we found it to be suitable and has been assessed for readiness. especially the facilities, for screening the travelers, and the quarantine and isolation facilities. So those are well. At the airports, at the ground ports like this one, what we normally want is to see the presence of a quarantine unit. There's a difference between the quarantine unit, and the isolation. The quarantine unit is the temporary, immediate area where you receive the suspected case, and then do all the initial assessment in the clinical examination. And if you find that that case needs to be isolated, then you take them to a further isolation unit, and this would be in a hospital facility. So at the airports we talk of quarantine units rather than isolation, quarantine. We separate the individual from the rest of the travelers, so they are quarantined. And then when it comes to the larger picture, where the client has got a problem which has been identified through clinical examination, they are then isolated. And the isolation facility, I'm happy, like the PMD indicated, the nearest one is Bulawayo. But I would like to assess, that is why I came here. I would like to see what can be done in terms of local isolation. I want to see about your quarantine area. We want to see whether it is relevant, as the PMD has indicated, because I haven't seen it yet. So I want to be able to pass it or condemn it, and I also want to encourage us to identify a local isolation unit at the hospital. We have to, even if it's just one room, and if it's a temporary isolation unit, it's fine. Before we move the client to the well-established Thorngrove unit, right? So that is what we're going to do. It's a fact-finding mission. I've been to Victoria Falls, and I found the facilities at Vic Falls Airport. They're actually the best so far. I don't know about here, we've seen it, so I can't judge before I see it. But Victoria Falls has got the best. I suppose it's because it's new. It's still a new airport. It has the best facility. It's got a quarantine and an isolation unit. Appropriately placed. The ground port at Victoria Falls, we made recommendations so that they can be able to improve there, so that they can have a separate screening room, and if someone is identified, to have a temperature, then they are quarantined. So we've also identified a quarantining section there. We'll be going around all the borders and making sure that we see all of them. In Harare, the isolation unit is at Wilkins Hospital. That is a very good facility, almost state of the art. They would obviously also need one or two upgrades, which they are already carrying out. We are very happy that in terms of detection of the virus, we now have the capability at the National Microbiology Reference Laboratory, which is at Salim Mugabe Hospital, formerly Harare Hospital. That is got state-of-the-art equipment. They've got about 4 what you call PCR units, or polymerase chain reaction units, which are there. You'll be able to get results within a very short space of time, at least 5 hours for now, instead of what we used to do before, where we would send the samples to KwaZulu-Natal, to the virology laboratory there. So we can do it here, in Zimbabwe, within the shortest possible time. Bulawayo also have a PCR unit at Mpilo, so we want to utilize Mpilo for the purpose of testing. No, that's the next move. And we want to decentralize by acquiring rapid results tests. You know, if you have gone for HIV testing, you know that it will take 15 minutes and then you get your result, isn't it? That's exactly what we want to aim for. So that we get those kits. We've already ordered them. We've identified the manufacturer, and we're going to get those kits. Once we have those kits, we will have them in all our border hospitals, so that it becomes easy initially, and then as we go on, we'll also keep some in most of our hospitals, so that if there is any suspect case, they can be able to immediately check, so that we don't have to wait for 5 hours. So they are well trained, they know what to do, but we also still want to make sure that we invite laboratorians, nurses, physicians, doctors, from all the provinces to come to Harare for further training, for further education. Learning does not stop, it will carry on. We want to have adequate personnel manning all our borders, manning our institutions with full knowledge. We want our workers to be well protected, fully protected. I went to one border, I won't say which one, I found it was a small room where everybody was coming through. Zimra was in there, immigration was there, Port Health was in there, and everybody was coming through. We found that was not conducive. Immediately changed that system so that we have a totally separate room for the screening, not inside where all the other travelers are. You have a task and a half here, I can see. It means that we need to identify more Port Health personnel. Otherwise, from those numbers that you were telling me, they will collapse. We need to have more members of staff, under the health banner, here, so that they can be able to have, what you call it, shorter rosters, rather than having to work for a long period. It's not easy to be putting on that mask continuously, but I have to say this, I was very happy. When I was walking through, I actually stopped to see how well donned and protected your staff were. We must clap our hands for it. I don't know whether you just did it for today or it's but it has to be all the time. It has to be all the time. So reporters, you can come and check tomorrow and let me know through the paper. So you see, I've got me some pizza there. My favorite. You're my favorite correspondent. Make sure you check on them. Make sure that they are still donning their masks. Because we want our members of staff to be well protected. That is key. There is nothing that is as painful for a member of staff to be infected. It would be very unfortunate if that happened. So we want to make sure that all our personnel are well protected. In future, we will even give you full kits, so that you don't end up with any infection. Advocacy, communication. Let's talk about it. Let's educate everyone on what this is, and we shall make sure that we win against this coronavirus. In China, as of yesterday, just to give you the figures have been rising. Last week I was talking about 28,000. This week we're talking about 59,805. That's a big jump. So we don't want to end up with any of those cases coming into Zimbabwe. We're making sure that we do everything. Let's be vigilant. let's assess, let's not leave anything to chance here in Zimbabwe and here specifically at Beitbridge border post. So I therefore urge observance of the important gesture by our health partners who have graciously supported the ministry. Without them, some of the assessments, training, information and progress reports, strategic supplies, recommended medicines would not have materialized. And I wish to thank the World Health Organization, the country representative, Dr. Alec Gasasira, and his counterpart at UNICEF, Dr. Moshiri, and the Chinese government, and MOSA, as I say, ZIMPAS, and all other partners who have supported or pledged their support towards our national readiness for COVID-19. And say your efforts mean a lot to the government of Zimbabwe. And I'm happy just by this meeting here on the state of preparedness, that you are exhibiting. Just by coming here and us sharing information means that we are prepared. And we also want to say we are populating our website with more information. Awareness is very, very vital. And therefore, CDC, WHO, they are sending us information and we are putting it on our website. And my team of experts, led by Dr. Posha and Nanagazira, will continue getting all these updates and putting them through the whole system. So, Minister, I want to say this is what I have, and I now want to get the opportunity to be able to actually see what it is that you put in place. I know my director of environmental health came here last week and he told me that, from the lessons that we had given him, he managed to put some issues in place. I also want to point out that the other issues that you have talked about regarding health systems here and in the province, we want to look at them holistically and be able to give as much assistance as possible. With this issue of mortuaries and things like that, we want to make sure that we make sure everything is fully functional. So we're going to look at that. I also received your document with pleasure, and I'm going to ensure that whatever has been stated in there is taken care of by my officers. We want to ensure that Beitbridge is a very, very busy town with a huge population coming through here, has got the most appropriate healthcare facilities so that we don't get any disease outbreak. Coronavirus, we don't want it. Coronavirus, stay out of Zimbabwe. Stay out of South Africa and in the Indian Ocean, not on the African land. I thank you.